Continuing the topic of imaging in gynecology, part 2. Here we speak about saline infusion sonography. It is also called as saline hysterosalpingography. Here you insert the Foley's catheter initially and inflate it, and through a cannula, so that what saline injected will not come out. So then you through a cannula, 30 ml of saline is injected into the uterine cavity, and fluoroscopic examination, you can visualize the movement of the saline into the fallopian tubes, and if it is filled into the pouch of Douglas, so it shows tubes are patent. So that is saline infusion sonography. Now Doppler technology. So Doppler technology, here you will know the vascularity. So in malignant tissues, the resistance index is less than 0.45 because of neovascularization. So this is seen in malignant tissues and also in infections. So the use of Doppler technologies in endometrial carcinoma, it will show whether there is myometrial invasion, and in torsion of the ovary, whether there is vascularity is preserved or not. So whether ovary can be retained or whether it has to be removed in case of torsion of the ovary. Now coming the algorithm for imaging in case of abnormal uterine bleeding. So in case of abnormal uterine bleeding, clinical examination is done. So if it shows carcinoma cervix, MRI is done. Suppose it shows other uterine pathology, ultrasound is done, USG. If it shows fibroid, then treatment is further. So if it is adenomyosis, to confirm it, MRI is done. Suppose USG shows endometrial hyperplasia, so indication for biopsy. If it shows hyperplasia only, then treatment is done. If it shows endometrial carcinoma, MRI is to be done. This is the algorithm for imaging in case of abnormal uterine bleeding. Now the algorithm for imaging in case of ovarian mass. Suppose there is a ovarian mass. What is the algorithm? So here you do USG first. If it shows presence of fat, it is a case of dermoid cyst. Suppose if it shows blood content, then you do Doppler studies. If it is does not show any changes malignancy, then it is endometriotic cyst. Suppose if it is suspicion of malignancy, Doppler shows malignancy. You do CT scan. Then suppose if it shows fluid, then it is a cyst, simple cyst. Suppose if it shows complex mass, do Doppler. Suppose if it shows a malignancy change, then it is CT scan is done. Suppose if it shows malignant change, CT scan is to be done. For this is the algorithm for imaging in a case of ovarian mass. That complex.